talk about a major process that we're undertaking as we start to look at the Healthcare Coalition and our strategic direction into the future. Kind of update you on that process, kind of where we're going. We're going to hear from Nancy and Katie from Snohomish County Health District to give us an update on lessons learned from the Oso mudslides that took place earlier this year, the recovery, the lessons learned in response. So I think that's going to be a really exciting presentation and opportunity for us as a coalition and as community healthcare responders to learn from that opportunity. Pretty exciting. We're going to talk about the Healthcare Coalition and what our potential role is in a response capacity, kind of as part of the day. And at the end, we're going to be soliciting some potential future speakers from organizations and entities that might be interested in presenting to the Healthcare Coalition on what you do and how you feel you are a partner within the Healthcare Coalition. So that's kind of our rundown for the day, what we're going to talk about and what we're going to share. And so maybe a representative for healthcare coalitions that the State Department of Health has stole her from us. And so although she is officially a Department of Health employee at this point, she is staying on with us and helping us through a transition period. So it's really nice for her to be able to do that. So if you get an opportunity to speak with Erica today and say goodbye and cry on her shoulder and make her feel really bad for leaving us, feel free.
Wow.
It's probably a little late for the guilt factor to reflect on her decision, but the good news is that although she's leaving our healthcare coalition, she's moving to the state and really will be part of our healthcare coalition in the future, but just from a state level, a different perspective. And I choose to think about it as a strategic move on the part of Region 9 Healthcare Coalition, because it's taken us 4 years to get Erica trained to the point where we can infiltrate the Department of Health with a mole. So she's going to serve a very valuable role for us as we move into the future. And so not that she's going away, she's just going to have a new role, and God help us trying to figure out go-to after she leaves.
Yeah, because I'm obviously so good at it. It's going wicked smooth right now.
So as part of that, and as we go through our agenda, you're going to hear that we're starting to look at our strategic plan, what our mission is, where we need to go into the future, and how we sustain our regional healthcare coalition and really continue to build a resilient healthcare system. So as part of that transition, we also have to look at the things that we're doing. So we have spent a lot of time on planning assistance and helping facilities, but we really need to take a step back a little bit and start to look at our business model. How are we structured? What is our capacities? What is our purpose as we look at enhancing the healthcare system? So we have hired a new person. Travis Nichols is here today. Travis has a business and policy background, which is really nice and key for our future direction. He also has a lot of experience in the outdoors because he worked at Mountain here for a few years. And so that is also a very good caveat as far as I'm concerned for any employee that works with us or that we have to work with. So welcome, Travis, and if you get an opportunity to say hi or introduce yourself to Travis so that he gets a better idea of who we are and who we represent, that would be great to take that opportunity, and I'm sure you'll get more chances into the future to have an opportunity to talk with Travis. So I guess one thing that would be interesting is, and I've talked to Todd already from Sunshine Health Systems, but there are some new faces in here today, so we're hoping that those of us that kind of work with the Healthcare Coalition, if you get an opportunity today, come up and talk to us. Let us know how you heard about the coalition. Let us know why you're here or what excited you to be here. So that we can continue that work and we can make sure that we're including you as we continue our planning efforts and our response capability decisions. So Erica is right here in the front corner. You'll hear from her, myself, Travis. Feel free to catch any one of the three of us if you get an opportunity before you leave today. Again, welcome, and thank you for being participants in our meeting today. And I think with that, we'll go ahead and get started and let Erica update you on all the great work that's been going on here at the Healthcare Coalition.
Thanks, Ed. So thank you very much, and just to reiterate what Ed said, I see tons of new faces in the room today, and it's really exciting for us because we do all kinds of outreach and promotions of our Healthcare Coalition, so we're really curious to hear why you're here today. How did you find out about the Healthcare Coalition? Who told you to come? Was it an email? Whatever. So please find us and let us know so that we know what's working, and we'll keep doing more of that stuff. So I wanted to share with you some of our, each year at our annual meeting, we like to talk about the accomplishments of the previous year of the Healthcare Coalition. So when we say 2013, 2014, we're talking about our grant year, which is July 1st of one year to June 30th of the following year. So we're talking about the grant year of 2013, 2014, and what we accomplished together as a coalition in the past year. Oh, and I use this mountain because Travis has this great outdoors background, and I kind of like that connection, and then also because I like mountains, and sort of this progression upwards. I feel like we've really done a lot this year and have gotten to a new place. So just a little bit about that. Okay, so this year we really had a good focus on education, and so I want to just talk about each of these pieces just a little bit. We had some business resiliency training this year, and for us this is really about helping our partners keep their doors open, providing patient care, and supporting the broader healthcare system even if there is an emergency. If we can't rely on the entire healthcare system during a community-wide emergency response, we're going to be in trouble. So it's really important to us as a healthcare coalition, it's important to each of you as healthcare coalition members that we're all prepared as best as we can be to keep our businesses operating if there's a disaster. The FEMA reimbursement workshop really focused on when there is a declared disaster, what can you do to get reimbursement for some of the damages and some of the expenses you incur as a result of that disaster. So we want to make sure that businesses are able to reopen their doors as soon as possible following a disaster and continue to be thriving businesses in our community, and again, still providing that really critical patient care that we need. We conducted one in the previous grant year and one so far in this grant year, emergency medical staffing exercise. So with this, we're helping our partners move their own internal plans forward. Spokane Eye Clinic's plan about emergency medical staffing. We got all of the critical team members from that clinic together in a room and presented them with a scenario around emergency medical staffing and let them do the work themselves of collaborating with each other, getting those assumptions and expectations right out on the table so that everybody understands everybody's role, everybody knows how the process will work, gaps are identified, strengths are identified, and they're able to move their own plans forward. And then we, as a coalition, can share their best practices with other participants in the exercise, participants in other exercises, and the coalition as a whole, which we did at our previous Healthcare Coalition meeting in May. We had a few presentations about emergency medical staffing. And then our WATRAC expansion. So because there's so many new faces in the room today, I want to just talk a little bit about WATRAC. This is our statewide hospital diversion and bed tracking system. So this is in use to varying degrees across the entire state with hospitals and in some regions with pre-hospital EMS transport and fire transport providers to really get an at-a-glance picture of what is our hospital capability and capacity at this moment. Are the emergency departments open? Is there an emergency department that's on divert? If so, why? If so, for how long? Do they not have any critical care beds? Are they deficient in a particular capability at this moment? So we have visibility, we as WATRAC users have visibility across the entire state of any medical facility who is on WATRAC. We can see the status of their facility. It's primarily hospitals who are inputting the information. So what we've done regionally, as you know, or as, I'm sorry, I don't need to say as you know, we adopted WATRAC as a region about a year and a half ago. It replaced a previous system that had been around for quite a while called Ramsey's. And so over the past year and a half, we've gotten a lot more usage in the system. We've gotten a lot more confident with the system. I think, it's always very uncomfortable to make a switch, especially with something critical like this that applies directly to patient care. But now I think we have a lot more confidence in the system. We trust the information, we know how our partners are using it, and we continue to have those conversations around how we can use WATRAC better, what are the various modules that we can leverage to really have a good healthcare system response on a day-to-day basis, and especially during an emergency. And I just wanted to call out that there are 2 state WATRAC employees who are here today, especially from the west side of the state. We have Barbara Andrews, who's the program manager, and we have Pam Taylor, who is our newly hired statewide trainer. So if there are ever any questions about how to use WATRAC, how can I get a report, we need training in our facility, Pam is available to conduct that either remotely or on site with some prior arrangements. And then we also participated, there was a statewide WATRAC strategic planning group this year to really nail down the future direction of WATRAC, how we should allocate the resources of these 2 fine women to work on expanding that system. So what do we, the users of WATRAC across the whole state, need and want from WATRAC? I was invited to participate on that group, and I happily accepted because it's important to me that Eastern Washington's voice is there, that rural Washington's voice is there, and I wasn't the only person representing those populations, but I was very happy to be included, and as a result, there's a new strategic plan specifically for WATRAC that Barbara and Pam can now start to work towards to make it a better system for everybody in Washington State. Relationships enhance our capacity, and I want to talk a little bit about that. So we did some work this year pre-positioning our alternate care facility trailers at key locations. And so what does this mean? We worked with our partners at the Spokane County Department of Emergency Management, at Spokane City Fire, at Sacred Heart Medical Center, and at Deaconess Hospital to make sure that we were prepared for some large events that were happening in Spokane in case there was a medical surge, in case we needed to set up an alternate care facility. We wanted these trailers close to the city. We normally store them not far away, but up near Chatteroy, and we wanted them right here in town so that we could quickly get inside them and get the cots and so forth set up. So that's sort of a leaning forward piece that we wanted to do this year. We have a really great working relationship with Department of Health. Even before I became a mole for Department of Health. They are great partners to us. We work really, really well with them, and they want to support us as much as possible. They sent some assets and staged them at Fairchild Air Force Base as a response to the really, really active wildfire season we had, especially earlier in the summer. There was talk of a potential hospital evacuation in Region 7, and DOH wanted to make sure that we were all ready for that. So those assets were sent over and staged locally to be deployed very, very quickly. We have something that we colloquially call Iowa cross-border collaboration with our Idaho partners. Janine Wilson is here today from Panhandle Public Health in North Idaho. And we meet with our Idaho Public Health and Healthcare Coalition partners pretty regularly. We're doing similar work, both in public health and in our healthcare coalitions, and we want to make sure that the work we're doing complements and supports each other. And where we can share resources together, where we can tackle a problem together, we want to make sure that we're seeing that ahead of time so we can work on it together. Another piece of that is that this year we were able to get WATRAC shared with some of our Idaho partners. We have Katie from St. Joseph's Hospital in Lewiston, Idaho is here, and again Janine Wilson from Panhandle Public Health. They have visibility now of our Washington State hospital diversion system. So they can see right into our hospitals what's going on in Washington. Is there capacity there? Is there capability there? Or, if the reverse is true, can we help Washington right now? Do they need some of our resources? They can see that by looking in WATRAC.
Also, Kootenai Health.
And Kootenai Health, thank you. And Jeff Ewing is here from Kootenai Health. Thank you, Janine. And then conversely, we now have access to view the Idaho system. And when I say we, we've only done this with a few partners on each side of the border, but Spokane Regional Health District and Deaconess Hospital as our disaster medical control center who helps with patient destination decisions if there's an emergency. So Deaconess and Public Health have visibility into the Idaho system, which is called IRS, Idaho Resource Tracking System. So we can see what's going on with their hospital. So this is a great collaboration for us. It helps us really quickly get situational awareness if there's an emergency. We're very grateful for the work that Janine did to make that happen. And then, of course, our hospital planning committee. I want to reiterate the title of this slide, Relationships Enhance Capacity. Relationships matter, and our hospital planning committee is a real testament to that. Our hospital planning committee meets every other month, and this is where employees in hospitals who do this work, who think about and work on emergency preparedness planning, come together. They network, they share plans, they share exercise ideas and outcomes. It's a really important piece of the work we do to facilitate these conversations and to get these groups together. And that's a really important piece of what the Healthcare Coalition does as a whole. We bring people together to have the conversations that you might not take the time out to have otherwise. So we're really proud of that and proud of the strong relationships that we have in our hospital planning committee. This year, the hospital planning committee and the non-hospital work group were really instrumental in developing a few resources for us. One of them was our medical resource inventory, and I won't talk about that now because I am going to talk about it later, but I just want to acknowledge that that resource, that tool could not have been created without the hard work of our hospital planning committee. So thank you to all the members present who are on that committee. We're always investing in the power of knowledge. We really believe in training and education and exercise and learning from our peers who have been there and done that. This year we had some really great stories from real-world healthcare emergencies and the people who responded to them and supported them. Just as an example, you may remember a few months back we had Lori Upton from the Southeast Texas Regional Advisory Council, or CETRAC. She came and spoke to us. She came up from Texas to talk to us about their all hazards planning, their response structure, how their healthcare coalition works, and really the unique structure of their whole organization with EMS is looped in with healthcare coalition. And it's a really fascinating model that they use all throughout the state of Texas and is really effective. So it's interesting for us to learn different healthcare coalition models and, again, to learn about their response role and really have some real-world application to why this work is so important. The National Healthcare Coalition Conference will be in its third year this December. The first year we sent a few people. Last year we sent 3 people. And these conferences have really helped us kickstart our own internal strategic planning discussions. First, Susan, you were the only one who went the first year? So the very first year of the National Healthcare Coalition Conference, we didn't really have a good sense of what it was. Susan went to kind of suss it out, and it turned out to be awesome. And so last year we sent 3 people, healthcare coalitions from all over the country, all sizes, all types, all different models of healthcare coalitions, coming together, again, sharing those best practices, sharing their various structures, learning from each other, excellent content. And really hitting home on some important topics for healthcare coalitions. What is our sustainability model? What is our strategic plan? What's it going to look like if and when the federal grant goes away? Those are things we need to be thinking about and talking about right now, and it's the National Healthcare Coalition that really got us to the point where we thought we need to really take these conversations seriously and move forward on this work. This year we'll be back at the National Healthcare Coalition Conference. I'll be part of a panel presentation. Susan is putting together a poster presentation. So we are right in the mix now with presenters and sharing a lot of the work that we've done. So along those same lines, some of the recognition that we get really inspires us to do better at the work that we do. Some of you may remember that last year we were visited by a team from the National Center for Disaster Medicine and Public Health. We had not previously heard of this organization, but it turns out they're pretty amazing, and they do a lot of national level work around emergency preparedness. They identified our coalition, one of 9 in the country that they visited, as being unique and really leaning forward on various aspects of emergency preparedness planning. So they came out to meet with us, which was a huge honor and very exciting to be included on that nationwide study. So what they did was they interviewed in depth 9 healthcare coalitions, and then last year at the National Healthcare Coalition Conference, they invited us back for a group discussion with all 9 of the coalitions, where they wanted to ask some further questions to inform a report that they then wrote to give to ASPR, the Assistant Secretary for Preparedness and Response, who oversees all healthcare coalition work and healthcare emergency preparedness work nationwide. So they took all that fact-finding and all of that resource learning from those coalitions across the country and really used that to inform the ASPR guidelines, to be a voice for healthcare coalitions across the whole country. So that was a huge win for us to be a part of that. And then the Washington State Public Health Association recognized us as a public health champion this year for our best practices in serving our rural healthcare partners. So these are really gratifying acknowledgments that, again, just encourage us to keep doing the work we do and to do it better. We want to respond when our partners need us. I like to say it began with event request by Jeff Ewing right there. But that's not entirely true. It didn't all begin with event request. I'll talk about that more in a different presentation later today, but I just wanted to acknowledge again this response piece that we're exploring for our healthcare coalition. And then we've got strategic planning in action right now. This effort is underway. We are full steam ahead. We started with a workshop in June. We got a report from our facilitators wrapping up some goals and recommendations for our healthcare coalition and sort of how we might want to move forward. And then following a debrief meeting on Monday, just a few days ago, we have a really good pathway forward, something that will evolve into a work plan to help us work on the sustainability of our healthcare coalition. It's a really exciting time to be part of the healthcare coalition, and it's another reason I'm so excited to see so many new faces in the room today. Just thank you for being here. So I won't say this is our end goal, but it's a big goal, and it's worth noticing. Our healthcare coalition stakeholders and partners are committed to creating a sustainable healthcare coalition for Region 9, and that means the world to us because, again, we think this work is so important. We're really invested in it. We're proud of what we've done, and we have a lot more to bring. So after following our strategic planning seminar, we really hear this loud and clear, that you believe in what we do and that you want this to keep happening. So I just want to thank you all for the passion you bring to this work. It's nothing if you're not participating. Thank you so much. And those are our accomplishments for 2013-14.